PSC നേഴ്സിൻ്റെ പുതിയ വീഡിയോയിലേക്ക് സ്വാഗതം. കേരള DHS സ്റ്റാഫ് നേഴ്സ് ഗ്രേഡ് 2 എക്സാമിൻ്റെ മെഡിക്കൽ സർജിക്കൽ ക്വസ്റ്റ്യൻസ് 151 മുതൽ 200 വരെയുള്ള ക്വസ്റ്റ്യൻസ് ആണ് നമ്മൾ ഈ വീഡിയോയിൽ ഡിസ്കസ് ചെയ്യുന്നത്. വീഡിയോ കാണുന്നവർ പഠിക്കാൻ ശ്രമിക്കുകയും റിപ്പീറ്റ് ചെയ്ത് കാണുകയും ചെയ്യുക. പഠിക്കുന്ന എല്ലാവർക്കും വിജയാശംസകൾ നേരുന്നു. പരീക്ഷ ജനുവരി മാസം 30 നടക്കും എന്നാണ് PSC അറിയിച്ചിട്ടുള്ളത്. പഠനം വേഗത കൂട്ടേണ്ടതായിട്ടുണ്ട്. അതുകൊണ്ട് സമയം പാഴാക്കാതെ ഏറ്റവും നന്നായി പഠിക്കാൻ ശ്രമിക്കുക. ഈശ്വരൻ എല്ലാവരെയും അനുഗ്രഹിക്കട്ടെ. നമുക്ക് വീഡിയോയിലേക്ക് കടക്കാം. The most common cause of epistaxis is associated with dash. The most common cause of epistaxis is associated with dash. Little's area. Cause of increased intraocular pressure or IOP is dash. Cause of increased intraocular pressure or IOP is dash. Increased production of aqueous humor by the ciliary process. Increased production of aqueous humor by the ciliary process. Surgical management of varicose veins is dash. Surgical management of varicose veins is dash. Ligation and stripping. Ligation and stripping. When a patient continues to hypoventilate, what complication may occur? When a patient continues to hypoventilate, what complications may occur? Respiratory acidosis. Respiratory acidosis. Diagnostic procedure in which pleural cavity is examined with an endoscope is called dash. Diagnostic procedure in which pleural cavity is examined with an endoscope is called dash. Thoracoscopy. Thoracoscopy. Mathew, who aged to become an organ donor, is pronounced dead. What is the most important factor in selecting a transplant recipient? Mathew, who aged to become an organ donor, is pronounced dead. What is the most important factor in selecting a transplant recipient? Compatible blood and tissue types. Compatible blood and tissue types. Dilatation of the papiniform venous plexus and the internal spermatic vein is known as dilatation of the papiniform venous plexus and the internal spermatic vein is known as varicocele. Varicocele, which indicates poor practice in communicating with a hearing impaired client. Which indicates poor practice in communicating with a hearing impaired client. Speak clearly in a loud voice or shout to be heard. Speak, speak clearly in a loud voice or shout to be heard. Which ECG lead shows changes in inferior wall MI? Which ECG lead shows changes in inferior wall MI? Lead 2. Lead 2. What is preload? What is preload? Pressure in the ventricle at the end of the diastole. Pressure in the ventricle at the end of diastole. Which enzyme released by damaged kidney causing constriction of blood vessel? Which enzyme released by damaged kidney causing constriction of blood vessels? Renin. Renin. A client is being evaluated for cancer of the colon. In preparing the client for barium enema, the nurse should. A client is being evaluated for cancer of the colon. In preparing the client for barium enema, the nurse should give laxative the night before and a cleansing enema in the morning before the test. Give laxative the night before and a cleansing enema in the morning before the test. Acute pancreatitis is manifested by elevated. Acute pancreatitis is manifested by elevated serum amylase. Serum amylase. Hypothyroidism in infants can result in dash. Hypothyroidism in infants can result in dash. Cretinism. Cretinism. What is the first line management of epistaxis? What is the first line management of epistaxis? Pinch the nose and move forward. Pinch the nose and move forward. Which gland is termed as crown of renal system? Which gland is termed as crown of renal system? Adrenal gland. Adrenal gland. Following investigation should not be performed in a patient suspected of brain tumor. Following investigation should not be performed in a patient suspected of brain tumor. Lumbar puncture. Lumbar puncture. A patient who has Sengsteigen's break more tube inserted suddenly experiences difficulty in breathing. Which action should the nurse take first? Cut and remove the tube. Jones criteria is used to diagnose rheumatic fever. Causative organism of diphtheria. Corynebacterium. Chemical burn in the eye can be managed with Instill a topical anesthetic, then irrigate the eye with a saline solution. Earliest sign of acute glomerular nephritis. Earliest sign of acute glomerular nephritis. Periorbital edema. Periorbital edema. Common complication associated with peritoneal dialysis. Common complication associated with the peritoneal dialysis is dash. Peritonitis. Peritonitis. Closure of semilunar valve results in dash. Closure of semilunar valve results in dash. S2 sound. S2 sound. Paget's disease is a dash. Paget's disease is a dash. Bone disorder. Muscle injury is termed as dash. Strain. Immediate hemostatic mechanism just following the injury is. Immediate hemostatic mechanism just following the injury is dash. Vasoconstriction. Vasoconstriction. Other name for chorea. Sandwich dance. Sandwich dance. Chest pain is described as pleuritic when it. Chest pain is described as pleuritic when it increase with deep inspiration and decrease when the patient sits up and leans forward. Increase with deep inspiration and decrease when then patient sits up and leans forward. Osteoporosis is a disease of bone. In a client with diabetes insipidus, the serum sodium level is dash. In a client with diabetes insipidus, the serum sodium level is dash. Increases. Increases. Hepatosplenomegaly is dash. Hepatosplenomegaly is dash. Enlargement of both liver and spleen. Enlargement of both liver and spleen. Tissue reaction is highest with which suturing materials? Tissue reaction is highest with which suturing materials? Plain catgut. DOTS therapy is used for the treatment of tuberculosis. Drug of choice in thromboembolic stroke is dash. Drug of choice in thromboembolic stroke is dash. Aspirin. Warfarin interferes with dash. Warfarin interferes with dash. Platelet activation. Platelet activation. Figure of 8 like appearance in of cardiac shadow on chest X-ray is seen in dash. Figure of 8 like appearance of cardiac shadow on chest X-ray is seen in dash. Total anomalous pulmonary venous connection. Total anomalous pulmonary venous connection. A client is confined to bed rest after a brain attack results in hemiplegia 24 hours after the brain attack. Which experience exercise should the nurse incorporate into the client's care plan? A client is confined to bed rest after a brain attack results in hemiplegia 24 hours after the brain attack. Which exercise should the nurse incorporate into the client's care plan? Passive range of motion exercises. Passive range of motion exercises. Palliative treatment is dash. Palliative treatment is dash. Designed to relieve symptoms and improve the quality of life. Designed to relieve symptoms and improve the quality of life. Alpha cells of pancreas produce. Alpha cells of pancreas produce glucagon. Glucagon. Chromosomal abnormality commonly associated with leukemia. Chromosomal abnormality commonly associated with leukemia. Down syndrome. Down syndrome. Basic nursing measures in the care of patient with viral encephalitis is. Basic nursing measures in the care of patient with viral encephalitis is dash. Providing comfort measures. Location of McBurney's point is dash. Location of McBurney's point is dash. Midway between umbilicus and right anterior superior iliac spine. The suture between the two parietal bones. The suture between the two parietal bones. Sagittal. Sagittal sutures. Most commonly seen carcinoma in elderly male is. Most commonly seen carcinoma in elderly male is dash. Prostate cancer. Prostate cancer. Commonest sign of aspiration pneumonia is. Commonest sign of aspiration pneumonia is tachypnea. Tachypnea. Increased ICP may cause. Increased ICP may cause. Increased BP. A case of blunt trauma following road traffic accident is brought to the emergency department in the condition of shock. IV fluids are infused but patient is not responding. The nurse would expect that the next step in management will be immediate laparotomy. What is the first line management of diabetic ketoacidosis? What is the first line management of diabetic ketoacidosis? IV fluids. IV fluids.
Thanks for watching. PSC നേഴ്സിൻ്റെ വീഡിയോകൾ ഇഷ്ടപ്പെടുന്നവർ ഈ ചാനൽ ലൈക്ക് ചെയ്യുകയും നിങ്ങളുടെ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുകയും ചെയ്യുക. വീഡിയോ കാണുന്നവർ ഈ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുകയും ഫ്രണ്ട്സിന് ഷെയർ ചെയ്യുകയും ചെയ്യുക. ധാരാളം വീഡിയോസ് PSC നേഴ്സ് എന്ന ഈ ചാനൽ ഉൾപ്പെടുത്തിയിരിക്കുന്നു. വീഡിയോസ് റിപ്പീറ്റ് ചെയ്ത് കാണാൻ ശ്രമിക്കുക. അത് നിങ്ങളുടെ ഓർമ്മയെ കൂടുതൽ ശക്തിപ്പെടുത്തും. നന്നായി പഠിക്കുന്ന എല്ലാവർക്കും ഞങ്ങൾ വിജയാശംസകൾ നേരുന്നു. നന്ദി, നമസ്കാരം.